Hello everybody, I am Dr. Prabakar and we are still in July Fibroid Awareness Month. And today I would like to discuss the number one question that patients ask me when they come to see me after being diagnosed with fibroids. But before that, I wanted to mention two quick things. The first is I plan on putting out a small video every week, every Monday. So look out for those and subscribe to this channel so you'll be notified when that comes out. And number two, I am a physician, but I'm not your physician. And so these videos are for information and education, but they are not meant to be medical advice. So feel free to learn from them and take this information to then have a more in-depth conversation with your own doctor about your specific condition. Okay. So when a patient comes to me after being diagnosed with a fibroid, usually from their primary care doctor, they're often freaking out. They've already Googled fibroids and all of the terrible things that can happen to you, and they are so nervous. Oh my gosh, how did I get it? What did I do? What did I eat? What can I do about it in the future? And all of this. But the number one question is, what did I do to get fibroids? Okay, that is the number one question on a patient's mind when they come to see me. And unfortunately, like so many things in medicine, we don't have an answer that is neatly packaged that I can deliver to that patient that says, okay, this is exactly why you had, why you got fibroids. There are so many factors that, play into fibroid formation. And I want to review the top 3 risk factors that, play a role. So the number one risk factor for fibroid formation is African American descent. In a previous video, I discussed the statistic, 27 million American women have fibroids, and a large number of these women are African American. By the time a woman is 50, if they are African American, there's an 80 to 90% chance that they've already formed a fibroid. Okay, so that's a huge statistic. So if you are African American, this is something that you should keep in mind as you enter your childbearing years, 30s, 40s, and before menopause, that this could be something that is going to affect me. Okay. Number 2, family history. There are a lot of patients when I start talking to them will say, oh yeah, actually I remember my mom and my grandmother actually also had a surgery due to fibroids and due to bleeding, and oh, now I remember my aunt also, and so on and so forth. So there's actually a pretty strong correlation with family history. So if you know that women in your family have fibroids, or women have had early hysterectomies, find out, is it because of fibroids? And that should be on your radar as something that you could potentially face. And number 3 is diet. There are so many studies now looking at diet and correlation with various conditions, medical conditions. And fibroids is one of them. There was a recent study from China that looked at 600 women, 300 who had fibroids and 300 who did not. And when they looked at the women who did not have fibroids, all other things being essentially equal, they found that the women who did not have fibroids were largely consuming a plant-based diet, especially with cruciferous vegetables like broccoli, for example. So there are links now between, plant-based foods and sort of prevention of fibroid formation, or at least preventing rapid growth of fibroids. So there is a link between diet and fibroid formation. So to review the top 3 risk factors of why someone develops fibroids: number 1, African American descent, number 2, family history, and number 3, diet. So we'll talk more about these, but if you are someone with fibroids or you know somebody with fibroids, please share this channel and subscribe to it. Feel free to email me or comment below on any particular topics that you would like to hear about, and I'll see you in the next video. Okay, bye.